So here's the thing. If you didn't document that you communicated with your UAP, your CNA, your patient care tech, how are you going to prove if there's anything that happened on your shift that you gave report? If it wasn't documented, we know the rule, it wasn't done. So a lot of the times we're so familiar with doing shift to shift report that we actually don't document that we are actually giving report to our CNAs, right? You're telling the CNA, hey, this patient is on fall precautions. Hey, this patient is a pureed diet. Hey, this patient, you know, XYZ, whatever. We are communicating these things with our UAPs, with our PCTs, with our CNAs. But if we're not documenting, we could be held liable. In the story that I shared, the patient had an order for a pureed diet, and it was a long-term care facility, so they all were in the lunchroom, and the CNA ended up giving the patient a peanut butter and jelly sandwich. We all know that a peanut butter and jelly sandwich or a peanut butter sandwich is not a pureed approved food. So when the CNA gave the patient the peanut butter sandwich and the patient was not able to swallow that appropriately, asphyxiated and passed away, the nurse who was in charge, the supervising nurse at that long-term care facility, was also roped in to that litigation. She was in deposition for a really long time, and as I said, that nurse actually ended up losing her license. At the end of the investigation, she ended up losing her license because there was no documented record of her telling the CNA that the patient had a pureed diet. There was no education done about the difference between a regular diet and a pureed diet and all that stuff. So guys, these things really happen, and we want to use the examples to protect us. Okay, so learn to chart to protect your nursing license. If you need help with that, grab my guide. It is in my profile, and it will definitely help you to document to protect your nursing license.